Lila, do you have to pee?
No.
You know it's bad to hold in your pee. Do you have to pee?
No.
Are you sure?
No.
Come on, let's go to the potty.
No.
Today's show, it's all about the things kids do that can help you lose weight, live longer, and sleep better. That was Lila, and her mom, Melissa, told us that Lila never admits when she has to go to the bathroom, or she'll hold it in for as long as possible, which, sadly, not only are kids guilty of that, a lot of adults are as well, right?
Yes.
So there's actually a reason why you do not want to hold in urine for too long. You know, number one is if you're on a long car trip and your bladder's full of urine, and if you are in an accident, the seatbelt could potentially rupture your bladder. That's one thing. But if you're constantly holding in your urine, you're not allowing the urine to flush out bacteria. So if all day long you're holding it in, believe it or not, the bacteria at the tip of the urethra here can actually enter through the urethra and migrate into your bladder. Now, if you urinate right here, you just flush it all right out. But as the bacteria seeds the bladder, this can create what's called a lower urinary tract infection, lower UTI. But let's say you're continuing to hold it. Well, in rare cases, that bacteria can then work its way up the ureter. Where does that lead? To the kidney. At this point, you've had a lower UTI that has now progressed to what's called pyelonephritis, a kidney infection. This becomes a little bit more serious because at this stage, you have systemic symptoms. With a lower UTI, you may have urinary urgency, frequency, burning. But once you get pyelonephritis, you'll have pain in your back, either one side or the other. You might develop fevers. You don't feel well. And this is the point in time where you're also having chills, maybe even some nausea and vomiting. If at this point you go see your doctor and you get prescribed the correct antibiotics, they'll check your urine, usually there's no major sequela. You're doing fine. But if you don't get it checked out, what can happen, particularly in the elderly, is that bacteria that's then hanging out in your kidney, causing a kidney infection, can actually migrate from there into your bloodstream. As these bacteria enter your bloodstream, you can develop something called bacteremia. The more the bacteria proliferate, you can develop something called sepsis. We've mentioned that on the show before. And sepsis is a systemic infection, and it can be truly life-threatening. Now, I don't want to imply that urinary tract infection is going to lead to sepsis in everyone, but in some cases it can. What you're seeing here is oxygen. In sepsis, your body literally goes into a hypermetabolic state, using up all the oxygen. You can develop blood clots or easy bleeding in certain parts of the body. Your blood pressure drops precipitously throughout your system. This can lead to multiple system organ failure, pneumonia, difficulty breathing, liver failure, and ironically, kidney failure to boot because you're severely dehydrated, you don't have adequate blood pressure, even heart failure. And here's the key. If you're never emptying your bladder, you are really increasing your risk for a urinary tract infection.
Right, and actually that's why there's a lot of mommies in the audience today. That's why pregnant women, we check their urine all the time just for all the sequelae that you just talked about, because a bladder infection can progress very quickly in a pregnant woman to a kidney infection and then sepsis.
One of the first signs you might see is clear urine, okay. But as your urine gets a little bit more cloudy, and this is really a telltale sign in really young or older patients who may not be able to tell you exactly what's going on. And an elderly patient who comes into the emergency department with fevers, and I see the urine looks like this, we pretty much have our answer. So don't hold it in.
Don't hold it in.